Vitamin D has been shown to relieve depression and seasonal affective disorder. It's critical for learning and memory, and it helps to prevent age-related cognitive decline. Vitamin D3 is the fat-soluble steroid hormone form of the vitamin D. This sunshine vitamin is considered essential. Your skin synthesizes the vitamin D3 from ultraviolet B sunlight. Nearly every tissue and cell in the body and the brain has vitamin D receptors. It's commonly associated with immune and bone health. Vitamin D3 for the brain is critical for the optimal cognitive health. It's an integral part of neurotransmitter synthesis, gene expression, DNA maintenance and repair, and the form of neuroplasticity that's needed for memory formation and retrieval. A vitamin D deficiency is an undeclared worldwide pandemic, and it affects nearly half of the population on the planet. The major cause of a vitamin D deficiency is inadequate exposure to sunlight. Wearing sunscreen with an SPF of 30 reduces the vitamin D synthesis in your skin by more than 95%. Working and living indoors in the modern world contributes to the problem, and those with a naturally darker skin tone require 3 to 5 times longer in the sun to make the same amount of vitamin D as those with a light skin tone. Also at risk of a vitamin D deficiency is anyone who works indoors, breastfed infants, older adults, and anyone who's homebound or who wears long garments for religious reasons. If you have fat malabsorption issues, you're obese, or you're on certain medications, you're also at risk. You risk a host of problems if you don't have enough vitamin D, like type 2 diabetes, depression, cognitive impairment, Parkinson's, or Alzheimer's, among others. Vitamin D with omega-3 is needed for serotonin synthesis, release and function, regulating executive function, sensory gating, and social behavior. And vitamin D3 is involved in the synthesis of GABA, glutamate, and glutamine, and also dopamine in the brain. Vitamin D3 protects against DNA damage through prevention of telomere shortening and inhibition of telomerase activity, and it prevents oxidative damage to the DNA. Vitamin D3 is involved in neuromodulation, regulation of neurotropic factors, neuroprotection, neuroplasticity, and brain development, all in areas of the brain that are associated with depression. Supplementation could be an important part of the treatment for depression. Vitamin D3 is unique because it's not a standard vitamin. It's actually a fat-soluble steroid hormone. Vitamin D is mostly made in the skin from sun exposure, not primarily from food like most of our other vitamins. When ultraviolet B, light from the sun, strikes the skin, your body synthesizes vitamin D3. Vitamin D that comes from your skin or from a food as a supplement is not active. It first requires hydroxylation in the liver by the enzyme D25-hydroxylase to 25-hydroxy vitamin D. Then 25-hydroxy vitamin D requires further hydroxylation in the kidneys by another enzyme to form the biologically active form of the vitamin D called 1,25-hydroxy-2D calciferol. You get some vitamin D from foods like fatty fish, beef liver, cheese, egg yolks, and mushrooms. Some foods in the US are fortified with vitamin D. It's added to breakfast cereals, soy beverages, yogurt, and margarine. Calciferol is also produced industrially for use in nootropic supplements and to fortify foods. It's produced by ultraviolet irradiation of 7-dehydrocholesterol, which is extracted from lanolin in sheep's wool. Vitamin D3 directly or indirectly regulates the function of up to 2,000 genes in the body and the brain. Vitamin D works in concert with the vitamin D receptors, which are located throughout the body and the brain. And recent research shows vitamin D is involved in nerve growth factor synthesis, which is responsible for the growth and the maintenance of neurons. Vitamin D is also involved in neuron apoptosis, and studies have shown low vitamin D levels interrupt the cell cycle, and this leads to several neurological disorders like dementia, Parkinson's, epilepsy, and schizophrenia. Alzheimer's disease is associated with a decrease in vitamin D receptors in the hippocampus. A lack of gene expression from insufficient vitamin D contributes to Parkinson's disease. Hypovitaminosis, or low vitamin D, is associated with an increase in pro-inflammatory cytokines and a decrease in anti-inflammatory cytokines. The increase in these specific cytokines is associated with the degradation of the myelin sheath, and this leads to multiple sclerosis. Studies are currently underway for using vitamin D3 to reduce seizures in those dealing with epilepsy. The anti-convulsant effect is based on vitamin D3's ability to regulate the expression of genes, a process that's mediated by the vitamin D receptors. Scientists and researchers in labs around the world continue to build on the knowledge for vitamin D and how this sunshine vitamin affects human cognition and overall health. Vitamin D activates genes that regulate the immune system and the release of neurotransmitters like dopamine and serotonin. Research has also located vitamin D receptors in areas of the brain that are linked to depression. A meta-analysis of clinical studies on depression and vitamin D status, including 31,424 participants, showed low vitamin D concentrations is associated with depression. One of several studies on vitamin D and depression showed that older adults with low vitamin D were 11 times more likely to be depressed than those with normal levels. And if you're currently using antidepressants without much success, the next study may provide some hope. A study conducted in Iran with 42 patients with major depressive disorder participated in a double-blind, randomized, placebo-controlled trial. One group received 1,500 international units of vitamin D3 plus 20 milligrams of Prozac for 8 weeks. In the 8-week trial, vitamin D and the Prozac combined was superior to Prozac alone in controlling the depressive symptoms. Vitamin D has been shown to play a critical role in neuron cell growth and differentiation, neuron transmission, and the neuroplasticity that's essential for optimal learning and memory. Vitamin D has been shown in the lab to protect against age-related cognitive decline. In one study conducted in Detroit, researchers worked with aged rats. Older rats have problems with cognitive testing, along with elevated levels of pro-inflammatory cytokines, decreased levels of anti-inflammatory cytokines, and higher levels of amyloid beta plaque protein in the brain. Supplementing with the vitamin D for only 3 weeks reversed the inflammation and improved the clearance of the amyloid beta, showing potential for using vitamin D to prevent the age-related cognitive decline. Vitamin D deficiency is a global health problem. Over 1 billion people worldwide are vitamin D deficient. Very few foods contain vitamin D, and the foods that are fortified are inadequate to provide a child or an adult's daily requirement. And to top that off, the media and the mainstream medical establishment have a hysteria about skin cancer and the use of sunblock. If you work indoors, wear excessive clothing, use sunblock, are dark-skinned, overweight, old, or consciously avoid the sun, you're at risk of a vitamin D deficiency. Pathogens can inhibit vitamin D receptors. A lack of natural sun exposure depresses vitamin D levels. Caffeine inhibits vitamin D receptors. Testosterone levels then decline. There's a risk of bone fractures. There's an increased risk of cancer, autoimmune disease, hypertension, and infectious disease. A severe vitamin D deficiency can result in dementia and Alzheimer's, and there can be increases in the symptoms of depression. Not too long ago, vitamin D was simply known as the bone vitamin, but there's been a surge in vitamin D research over the last 10 years. Out of that research, it was discovered nearly every cell type and tissue in the body has receptors for vitamin D, and this quickly changed how we understood the role of vitamin D in the body. We now know vitamin D deficiency is a problem worldwide. To put this in perspective, studies estimate 64% of Americans don't get enough vitamin D. We now have clinical evidence that vitamin D influences the immune system and autoimmune disease. Heart health, prevents infectious disease and supports optimal cognition. Vitamin D deficiency has been linked to Alzheimer's and Parkinson's disease, asthma, autism, depression, cancer and diabetes. A Japanese study found 1,200 international units of vitamin D per day reduced the risk of getting the flu by almost 50%. One 7-year study showed vitamin D deficiency substantially increased the risk of non-Alzheimer's dementia. Another 7-year study associated higher vitamin D levels with a significantly lower risk of developing Alzheimer's. Animals and human studies suggest vitamin D could help in the prevention and the treatment of cognitive decline and dementia. If you work or spend most of your time indoors, you're getting less sun than you should, and you might notice that your mood deteriorates relative to the amount of time that you spend inside. This is especially noticeable in the winter if you live well north or south of the equator. Many who supplement with D3 report feeling happier, energy levels are higher, and feelings of depression stay away. Some report a noticeable decrease in fibromyalgia pain. Pain after exercise is less pronounced. Seasonal depression is officially known as Seasonal Affective Disorder, or SAD. Vitamin D3 is a potent remedy for many who experience this. It'll keep the winter depression at bay and reduce mood swings. Many report supplementing with vitamin D3 reduces insomnia, sleep is deeper, and your mood is better the next day. A study led by Professor Prue Ames of Children's Hospital Oakland Research Institute demonstrated that oxytocin, serotonin, and vasopressin are all activated by vitamin D. Abnormal social behavior is one of the symptoms of autism, and it's been previously linked to low serotonin and vitamin D levels in the brain. This study shed light on the mechanism of action that could explain this relationship. The study showed vitamin D activates the transcription of serotonin synthesizing gene, tryptophan hydroxylase 2, in the brain at a vitamin D response element, and it suppresses the transcription of TPH1 in tissues outside the blood-brain barrier. The study explains this mechanism shows how low vitamin D hormone level results in aberrant serotonin synthesis, and this leads to abnormal brain development. The study's author suggests supplementation with vitamin D and tryptophan is a practical and affordable solution to help prevent autism and possibly ameliorate some of the symptoms of this disorder. Dementia is one of the greatest health challenges of our time. An estimated 44 million people worldwide suffer from dementia. This number is expected to triple by 2050 as the population ages. A recent study at the University of Exeter Medical School found that adults who were slightly deficient in vitamin D had a 53% increased risk of developing dementia of any kind. That risk increased to 125% in those who were severely deficient in vitamin D. Another study at the University of Heidelberg in Germany included 3,316 patients who were referred for evaluation for their arteries. Those with low vitamin D levels were found to be more likely to have fatal strokes within the next 7 years. The researchers concluded vitamin D supplementation is a promising approach in the prevention of strokes. Seasonal affective disorder is a mood disorder characterized by depression, and it occurs during fall and winter months when sunlight levels are low. Seasonal affective disorder typically coincides with a sudden drop in vitamin D in the body. Several studies have suggested that seasonal affective disorder could be due to the changing vitamin D3 levels, which affect the serotonin levels in the brain. One study with adults dealing with vitamin D deficiency found supplementing with 4,000 international units of vitamin D daily for 2 months. It relieved their depression symptoms. Another study recruited 441 people into an outpatient clinic in Norway, and this randomized double-blind trial had patients use 20,000 or 40,000 international units of vitamin D per week or a placebo for a year. Subjects with serum vitamin D levels below 40 nanomoles per litre were significantly more depressed than those with levels above 40 nanomoles per litre. In the two groups given vitamin D, there was a significant improvement in depression symptoms after a year, but no improvement in the placebo group. The study concluded there appears to be a relation between the serum levels of 25-hydroxy vitamin D and the symptoms of depression. Supplementation with high doses of vitamin D seems to ameliorate these symptoms, indicating a possible causal relationship. 4,000 international units of vitamin D is recommended per day in the form of vitamin D3. It's fat soluble, so it should be taken with a meal that contains healthy fats. A study published in the American Journal of Clinical Nutrition suggests optimal vitamin D status is achieved with a serum blood test for 25-hydroxy vitamin D with a concentration of greater than 75 nanomoles per litre. It's possible to get your daily dose of vitamin D from the sun, and your total body sun exposure provides the equivalent of 10,000 international units of vitamin D. But chances are none of us have the opportunity to get the right amount of sun each day. To determine how much vitamin D that you need to achieve the optimal concentration, it's crucial to have a blood test. Researchers found if your blood vitamin D status was less than 55 nanomoles per litre, you need a daily intake of 5,000 international units. And for those above 55,000 nanomoles per litre, you need a dose of 3,800 international units. The Institute of Medicine also found that a dose for the lowest observable adverse effects is 40,000 international units of vitamin D per day for 12 weeks. Vitamin D is non-toxic, so it's considered well tolerated by the body. Side effects are rare, but they can include dry mouth, fatigue, headache, a metallic taste, nausea, sleepiness and vomiting. Doses of vitamin D higher than 4,000 international units per day are possibly unsafe because it could cause excessive blood levels of calcium. But note, much higher doses are sometimes used for short-term treatment of a vitamin D deficiency. Also, this risk can be reduced or eliminated when vitamin D is taken with vitamin K2. Vitamin D could worsen atherosclerosis or hardening of the arteries. If you have sarcoidosis, histoplasmosis, or are hyperthyroid, have lymphoma, or tuberculosis, vitamin D could increase blood calcium levels, causing kidney stones and other problems. Vitamin D may affect blood pressure, so be cautious about using vitamin D if you're dealing with blood pressure disorders or are taking drugs or supplements that can affect blood pressure. Some drugs used to lower cholesterol or treat psoriasis, calcium channel blockers, corticosteroids, or other drugs can interact with vitamin D. Check the University of Maryland's Possible Interaction section to find out more about these. The preferred way of getting vitamin D is by exposing your skin to the sun, but the colour of your skin can affect the way you synthesize this vitamin. Lighter skin can require 45 minutes of exposure 3 times a week, but dark skin can require up to 3 hours of exposure 3 times a week. Since most of us spend too much time indoors, and we've a nasty habit of using sunscreen when we go outside, to maintain adequate vitamin D levels, supplementation is the best option. Vitamin D3 is preferred over vitamin D2. A meta-analysis by the Cochrane database investigated the mortality rates for people who supplemented with vitamin D2 or D3. The analysis of 50 randomized controlled trials included 95,000 participants, and it showed a 6% risk reduction among the people who used D3, and a 2% risk increase in those who used vitamin D2. The overwhelming evidence shows that you're more likely to die from using vitamin D2 rather than D3. So if your doctor prescribes synthetic vitamin D2 or Drisidol, decline and get a vitamin D3 supplement instead. Your body does make vitamin D on its own from synthesizing UVB sunlight on the exposed skin, but all kinds of things can interfere with you getting enough vitamin D from the sunlight. The fall and the winter in both hemispheres, cloud cover, smog, your skin color, sunscreen, and too much clothing are some factors. Most of us spend too much time indoors to get the benefits, so we need to supplement with vitamin D3. It's best to get your vitamin D levels checked. Be sure to do a lab test for 25-hydroxy vitamin D, and then to raise your blood levels of vitamin D to the optimal levels, you need to take 100 international units of D3 for each 1 nanogram per milliliter that you need to raise. Vitamin D is especially helpful for anxiety and depression. Vitamin D deficiency has been associated with depression, schizophrenia, psychotic symptoms, and suicide. It's also helpful for people who are dealing with autism, Alzheimer's, and Parkinson's. For more information about herbs, supplements, and natural treatment plans, check out my website.